Hi guys, welcome to my channel. Let's talk about vaginal infections today. So lots of you might have experienced an episode of vaginal infection or two before in your lifetime. Some of you might have never experienced an episode before, but today let's look at the types of vaginal infections, the risk factors, how they are treated, and if they come with certain complications later in life. Okay, so vaginal infections are usually caused by bacteria. Some of them can be caused by viruses, some can be caused by fungi, and others can be caused by parasites. Okay, there are certain things that increase your risk of vaginal infections. Some of these include being sexually active, especially if you've had a new sexual partner recently. If you use certain contraceptive types, for example an IUD, it can increase your risk of vaginal infections. If you are somebody who likes scented perfumes and soaps down there, you would increase your risk of vaginal infections. If you are immunocompromised, for example, because you have certain illnesses like diabetes or HIV, your risk of vaginal infection is a little higher than somebody who isn't immunocompromised. If you're using certain medication like steroids, it also increases your risk of vaginal infections. If you're somebody who has passed the postmenopausal stage, because of the changes in your hormones and the changes that go on down there, you might be at an increased risk of vaginal infections. So let's look at the type of vaginal infections, their treatment, and what they come with. Okay, so the very first one we look at right now is bacterial vaginosis. This is one of the most common types of vaginal infections that is seen in sexually active people or sexually active women. It isn't considered an STI or a sexually transmitted disease, but it does come or it does happen a lot in people who are sexually active. Some of the symptoms of bacterial vaginosis are a thin or gray, gray or whitish discharge that smells like fish. So if you notice that you smell like fish down there, then you very likely have bacterial vaginosis and you need to let your OBGYN know about it. Treatment options usually come with pessaries or vaginal tablets that you have to insert for a couple of days, and after this you very likely might be okay. Another very common vaginal infection type is candida. Candida comes with itching down there. You might notice some redness down there. Sometimes you might have a cottage cheese discharge, very whitish discharge, thick cottage cheese like discharge in your underwear. If you notice this, you might have vaginal candidosis or candida, and your OBGYN can treat you, give you some pessaries to insert, or in some cases give you some pills to take to be able to clear this infection type. So other types of vaginal infections that we will look at today are herpes or genital herpes and genital warts. Genital herpes is usually caused by herpes simplex virus type 2, but in some cases herpes simplex virus type 1 can also cause genital herpes. So for example, if you have oral sex with somebody who has herpes on their mouth and they put their mouth on your genitals, when they have active blisters on their mouth, then there's a likelihood that they would affect you with the herpes. And once you have this herpes infection, it never goes away again. It stays with you for the rest of your life. It comes back, or it keeps coming back as soon as your immune system changes or your immune system becomes a little compromised. So you might notice that if you get sick, or if you have a fever, or if you have like a flu, you might notice that the blisters come back again. These are treated with antivirals that suppress or make you feel better when you realize that the blisters are coming back again, or you're having another episode. As soon as you notice this, let your OBGYN know about it to prescribe you antivirals to take care of this. If you notice that you're having sexual intercourse or you're having oral sex with somebody with active blisters on their lips or on their genital area, please stay away from this. In men, for example, you might notice that they have some blisters on their penis, at the tips of the penis, or they might have some open sores. These are red flags. Please do not have sex with somebody who has active herpes going on. In women, you might notice that these blisters or sores might come on the outside of the vulva or on the vulva, and some on the inside this way. So just pay attention to this. I don't know what your orientation is, but pay attention and make sure that you do not have a sexual intercourse with somebody who has an active herpes infection going on. Genital warts is also sexually transmitted, and it is caused by human papilloma virus. And you can get genital warts by having sexual intercourse with somebody who already has the warts, so it's sexually transmitted. So if you have genital warts, this can be taken care of surgically by scraping it off, removing the lesions, freezing it off. Sometimes their warts are very small and they go away by itself, but usually they become too much or too huge and they have to be removed by surgical means. Okay, then we also look at gonorrhea and chlamydia. These are very common STIs, or sexually transmitted infections, that come with symptoms down there. So if you have gonorrhea or you have syphilis, if you have gonorrhea or you have chlamydia, you might notice that you have some discomfort during sexual intercourse, pain during peeing, pain in your abdominal area. You might also notice that you have intermenstrual bleeding. Some of these things can be confused with the problems with menstrual cycle or a UTI, which usually comes with burning sensation, pain in the abdomen, sometimes blood in your urine. But make sure that you don't confuse an STD or sexually transmitted infection with a urinary transmitted infection, because if these two are not treated very well, they can lead to pelvic inflammatory diseases, and they can cause you problems with fertility later on in life. One last one that we would look at is trichomoniasis. So trichomoniasis is also a sexually transmitted disease that is caused by parasites. And this trichomoniasis usually comes with symptoms of very bad smelling green discharge. So if you know, or if you notice that you have very bad smelling green discharge down there, then you very likely have trichomoniasis. All these sexually transmitted diseases and all these vaginal infections very likely or usually are very easy to treat if you go early and seek help. If you take too much time, it can cause complications that might make the treatment process a little more difficult. So once you know these symptoms, and once you know how to seek for help, and once you know how these are treated, usually with antibiotics, antivirals, or antifungal medication, then you know that you don't have anything to worry about. Please don't hide these symptoms. Don't keep it to yourself, thinking that going to your OBGYN might make you look silly or might make you look promiscuous. We don't really care about what you do with your life. All we care about is helping you to solve these issues. So if you have this problem, come in. We are very glad to help you out. Now that you know all these things, let me know if you've had an STD, if you've had a vaginal infection before, and how you went about it. There are some that are very difficult to treat because they are chronic, but once you change your diet, once you change your underwear, and once you have a therapy regime put in place for you by your OBGYN, you very likely will be okay. Thank you for joining me on this episode. My name is Dr. Dixie, aka Dr. Zoo, and I love to share with you. See you next time. Bye.